Okay, thank you for the opportunity. My name is Putri Putri, and my last three-digit of my student number is 07. Greetings to all doctors and friends. Today we would like to present our student project. Here are the members of SGD 3.
Thank you for the opportunity. My name is Julyvia Gifensius with the last three-digit registration number 088. I will now explain about the importance of communication and palliative care. Palliative care relies on effective communication tailored to the unique needs, goals, and preferences of patients and their families to enhance comfort, dignity, and quality of life. This involves exchanging information, emotions, and values through verbal and nonverbal interactions, active listening, and compassionate responses addressing sensitive topics like prognosis, treatment preferences, and end-of-life decisions. Communication in palliative care encompasses clinical, psychosocial, and ethical aspects, providing emotional support, clarifying patient concerns, and aligning care plans with patient values. It fosters trust, reduces emotional burdens, and ensures families feel informed and supported during decision making processes. Research highlights that empathetic and transparent communication improves emotional resilience, satisfaction with care, and symptoms management, ultimately leading to a more meaningful and dignified end of life experience. That's all from me. Thank you.
Let me introduce myself. My name is Bagus Tresna Indra Putra Pramana with the last digit of student number 104. And now I'll explain about the problem formulation for this paper. Palliative care focuses on enhancing the patient's and their family's quality of life by reducing the stress and symptoms associated with a serious disease. For patients' requests, preferences, and values to be honored in palliative care, effective communication is crucial. Nonetheless, a lot of medical professionals have trouble communicating in a clear and caring manner, sometimes as a result of inadequate training, time restraints, or emotional challenges when talking about end-of-life matters. Increased anxiety or mental discomfort, miscommunications on the aims of therapy, and patient and family dissatisfaction might result from this. Here are the problem formulations related to the topic of the importance of communication in palliative care. Number 1, what is the definition and the scope of communication in palliative care? Number 2, what are the roles of communication in palliative care? Number 3, how do we build effective communication between healthcare professionals and families in palliative care? Number 4, what are the emotional and psychological aspects of communication in palliative care? And number 5, what are the impacts of communication in palliative care on patients' quality of life and outcomes? The objective of this paper is to give a comprehensive review that can inform more effective public health policies and interventions. Specifically, the objectives of the paper are: number 1, to define communication in palliative care; number 2, to identify and examine the scope of communication in palliative care; number 3, to explore the ways of building effective communication between healthcare professionals and families in palliative care; number 4, to explore the emotional and psychological aspects of communication in palliative care; and number 5, to explore the impacts of communication in palliative care on patients' quality of life and outcomes. And for the benefits of this paper can be divided into theoretical benefit and practical benefit. For the theoretical benefit, a key component of patient-centered care which places an emphasis on respecting patients' needs, values, and choices is effective communication. Theoretically, improved communication enables medical professionals to gain a deeper understanding of patients' desires, fostering their autonomy and guaranteeing that their values inform treatment choices. Theoretically, improved communication abilities foster better trust and therapeutic interactions between patients, families, and caregivers, resulting in more individualized, morally sound treatment that complies with patient preferences. In the practical benefit, in actuality, better communication benefits patients and their families in measurable ways on an emotional and psychological levels. Patients feel less anxious and have more control over their care when open and caring discussions on treatment objectives, symptoms management, and end-of-life desires are facilitated. Families gain from improved comprehension, less uncertainty, and more peace of mind, which eventually results in less emotional discomfort and higher levels of satisfaction with their caregiving process.
Okay, thank you for the opportunity. My name is Pradnya Putri, and my last three digit of my student number is 067. And today I'm going to explain about the definition of communication in palliative care. So, as we all know, communication is a dialogical process that involves the patient, family, and also medical professionals exchanging both empathic and information. Effective communication, care conversation is built on shared decision making, which guarantees that patients' desires are respected and fulfilled and they feel heard. This could be accomplished by openly discussing about the possibilities after learning about their values. And effective communication promotes the equality between the conversation partners and also fosters an environment where the patients and family members feel comfortable and also feel the concerns and the preference regarding care and also treatment. After that, to ensure that the communication are as high quality as possible, every method that we know must be employed. That's all about my presentation. Thank you for the opportunity.
My name is Tjokorda Putri Mahadewi with last digit number 189. I will explain about the scope of communication in palliative care. The scope of communication in palliative care is essential for fostering collaborative relationships among healthcare providers and ensuring that patient and of life preferences are honored. Training in communication skill, the use of telehealth, and a focused emotional support are critical components that enhance the overall quality of palliative care. And that's all from me. We'll continue my friends. Thank you.
Good afternoon, my name is Philbert Purbowo and the last 3 digits of my name is 148. In order to see the role of communication in palliative care, we need to first identify the main themes of effective communication itself. The first theme would be open and honest information, as many patients prefer to know their situation, which includes the diagnosis, treatment, prognosis, and other things. Studies show improvement of patient satisfaction when they're able to talk about the details of their situation. This also leads to better rapport, increases their trust, gives a sense of security, safety, and control over their health. The second would be aligning to the process of uptake and coping with information, as personal conversations between physicians and patients may be more relieving for patients, as they're able to talk about their situation. The next theme would be empathy, as patients and relatives express the need for empathic communication. Another theme would be clear and understandable language, because a misunderstanding may lead to patient feeling overwhelmed, insecure, isolated, excessive tension, or uncertainty. Another theme would be the presence of positive coping strategies, as it allows patients to have a sense of security despite bad news. While another theme would be the commitment of healthcare workers in taking responsibility, as it gives a sense of trust, security, and a better sense of connection between physicians and their patients. Now, the last theme would be the recognition of relatives in their role as a caregiver, as most patients often rely on their caregiver, and many feel burdened and require attention and recognition from their physicians. Many people prefer to understand this information required about the situation in order to provide better care for the patient, and it is our job as physicians to be able to provide what they need. That's all from me. Thank you.
Hi, my name is Nyoman Gayatri Virananda with the last 3-digit number 126, and I'm about to explain the communication between healthcare professional and family in palliative care. So in palliative care, the communication is very important, especially the role of nurses. They clarify information for families and act as intermediaries between physicians and families. They can provide honest communication balanced with hope and offer families support and choices by giving them the chance to make the big decisions and supporting them along the way. So they can recognize also the patient's reactions as information and allow time for families to process information, helping them give repetitive information and allowing them to process those information. They also have to recognize when to give empathy and when to give professionalism in these communication times. It is also important for effective communication to be done. They have to use clear, concise, and non-medical language and avoid overwhelming patients with information and avoid false hope. And it is also important for them to understand and observe nonverbal cues from patients like confusion, willingness, hesitation, to provide a more supportive role next.
Let me introduce myself. My name is Samantha Petrona Theobald with last three student numbers 108. So let me continue the presentation. So for the pathophysiology of basalt abscess, a complete aerated pneumatization of mastoid bone is the important component for basalt abscess. The mastoid bone dominantly consists of antral cells during the birth. Through the cells, development of air cells occurs, resulting in total mastoid bone pneumatization. The process happens at the age of 5. During the process, the walls of mastoid bone become thin, especially the end of mastoid bone. The medial surface along the incisura digastrica. In the incisura digastrica, attachment of the digastric muscles takes place. This whole process makes the mastoid bone susceptible for infection. When infection occurs, both bacteria and secretions enter the eustachian tube to the middle ear and go directly to the mastoid bone through adductus ad antrum opening. During inflammation of the middle ear, adductus ad antrum are obstructed. It causes the purulent secretion to be trapped and accumulated in the mastoid bone. The purulent substance on the mastoid bone results in pneumatized air cell, which is already fragile enough to be inflamed and death. This will thinning the wall further. The inflammation spread inferiorly to the end of the mastoid, causing the thin bone along insertion of digestive muscles to be gradually destroyed. Thus, the purulent substances will eventually spread to the area between digestive and sternocleidomastoid muscles. Prolonged infection caused the end of mastoid outer wall to be infected together with sternocleidomastoid muscles, trapezius and splenius capitis muscles.
I will continue the presentation. Before that, my name is Prema Pradnya Prashanti with the last 3 digits of my student number are 064. I will continue the presentation with emotional and psychological aspects of communication in palliative care. So people with advanced illness might experience significant psychological pressure. The psychological pressure can lead to anxiety or depression in as many as 50% of patients receiving palliative care. Therefore, psychological support is recommended to be one of the important components in comprehensive palliative care. All members of the healthcare professionals who handle patients with advanced illness and their families have the responsibility to provide psychological support to patients and their families. In addition, stress screening and psychological intervention can be conducted to manage psychological issues experienced by patients and their families.
Okay, thank you for the time. My name is Yuda, and in this next occasion, I would like to explain about the emotional and psychological aspects of communication and palliative care. The key points on effective communication in palliative care with focusing on emotional and psychological aspects such as the first one is empathetic and clear communication. Open, honest, and empathetic communication is essential to address patients' emotional needs, fostering trust and connection while acknowledging their coping process. The second one is recognition of family roles. Involving and supporting family caregivers is vital as they play a critical role in the patient's care journey and overall well-being. The third one is addressing emotional and existential needs, providing a space for patients to express their thoughts and feelings help address often overlooked emotional and existential concerns, enabling therapeutic relationship. The fourth one is tailored psychosocial support. Interventions like psychological counseling, family meetings, and activities such as life reviews or therapeutic writing enhance dignity, hope, and self-worth, improving quality of life. And the last one is compassionate bereavement care. Post-death bereavement services for families help process grief and adapt to loss, ensuring ongoing emotional support and compassionate care. Okay, that's all from me. For the next speakers, the time is yours.
So, hello everyone, my name is Adellya Pramesty with my last 3-digit number 165, and here I am gonna explain about the impact and quality of life and patient outcomes. Doctors, patients, and family have different perceptions when dealing with illness. Frequently, this causes clashes which impact patients' quality of care and quality of life. A dilemma that often occurs in palliative care situations in terminal patients is the family's expectation to prolong the patient's life with certain interventions, such as cardiac resuscitation or prolonged use of ventilator, whereas these aggressive interventions are actually painful and disadvantageous for patient survival. However, if these are undone, the family's satisfaction towards doctor's actions and trust decreases. Thus, effective communication is needed, as the main bridge to synchronize the thoughts of them all, so the main goal of palliative care, which is maintaining the patient's quality of life until reaching the good end of life, can be achieved. Effective communication can be achieved if doctor understands the needs of patient individually. This is applied as patient-centered care. Patient-centered care is based on respecting and understanding patient and family preferences. Generally, patients and family have their own preferences regarding the care, such as providing straightforward and open information. Straightforward information, like saying cancer is literal rather than avoiding the word, can increase the patient's sense of security and trust in doctors. This will help patients recognize their condition and give them confidence to choose treatment options based on their preferences. With their participation in care, the quality of care, quality of life, and general condition of patients tend to improve. On the other hand, close information will confuse and create uncertainty for patients and families, making it difficult for them to think positively about their condition. However, this could be paradoxical. Patients often find it difficult to accept bad news from doctors. In order to protect a patient's hope for life, families consequently prevent the doctor from openly informing the patient about their condition. Therefore, doctors need to view patients as humans, not just their illnesses. This requires a doctor's empathy. Doctors need to give patients and families time to digest what they are experiencing while providing emotional support to them. In the end, they can have enough confidence to accept the condition they are experiencing. Acceptance of the condition then leads patients and families to increase awareness of their illness, including increasing literacy about their health. Along with that, physical and mental conditions will be better.
Thank you, Doctor and Dominator, for the time that given to me. In this section, I will continue about the impact on quality of life and patient outcomes. So the touch has a significant impact on patient-centered outcomes. Combining touch with other nonverbal strategies like active listening, eye contact, and smiling may enhance its effectiveness on improving patient-centered outcomes. The nurse aid initiated communication, which includes smiling, touching, and emotional support, was highlighted as essential building rapport. The, the verbal communication positively influenced patient-centered outcomes. And the last is both verbal and non-verbal communication strategies are consistently linked to better patient center. That's all from me. Thank you.
Right now, I will explain you about the conclusion, but before that, let me introduce myself. My name is Tabitha, Etrina, Beru, Sembiring, with the last three digits of student number 232. So, palliative care communication is a crucial dialogical process that involves patient, families, and healthcare professionals working together to make collaborative decisions while prioritizing patient preference. Healthcare providers play a vital role in sharing clear prognostic information and treatment options while building sympathetic relationships with both patient and their family. The success of this communication relies on 5 key elements: honesty, empathy, plain language, support for coping mechanism, and recognition of family role in care. Effective implementation requires both verbal and nonverbal technique with a consistent focus on patient needs and cultural sensitivity. When executed properly, good palliative communication leads to enhanced quality of care, increased patient satisfaction, and improved overall well-being and care outcomes. The patient-centered approach answer to the end of the life care addresses not only physical needs but also physiological, social, and spiritual aspect of care, ultimately contributing to a more dignified and comfortable experience for patients in palliative care.
Okay, that's all about our student project presentation. Thank you for paying attention and have a nice day.